Hello everyone, my name is Dr. Stefan Ivantu. I'm a consultant psychiatrist specializing in adult ADHD. Today I'm going to speak about ADHD in women. It is quite common for women to come for an ADHD assessment and wonder why for a long time they have been suffering from symptoms of anxiety or depression. In some situations, they may have accessed different support experiencing limited success. Because the symptoms of hyperactivity and impulsiveness are less likely in women, they may be more difficult to be diagnosed with adult ADHD. Women are more likely to silently suffer from inattentive symptoms, which are more difficult to diagnose, causing anxiety or feelings of not being good enough. The previous ratios in diagnosing ADHD in children were 5 boys to 1 girl. This can be one of the reasons why a woman suffering from ADHD is more likely to be diagnosed later in life. We need to be mindful that for many years it was thought that this condition affects only men and not the hyperactive young boys, which is not the case. With time and new research available, it will be interesting how ratios are going to change in the future. Why ADHD symptoms in women can present different? The ADHD symptoms are more subtle compared with men. Women may be better at masking their inattentive symptoms. Outbursts and emotional dysregulation can be more frequent and sometimes can be misunderstood. Women with ADHD present more frequently with inattentive symptoms. Anxiety may manifest psychologically in the form of headaches or migraines. Hormonal changes and estrogen may play a role in the presentation of ADHD in women. Symptoms of ADHD in women may be viewed as anxiety, depression, or personality traits. Women suffering from ADHD tend to space out and daydream due to inattentive symptoms. ADHD in women and comorbid conditions. When symptoms of ADHD in women are well managed, the symptoms of other mental health conditions can vastly improve or achieve what we call remission. However, it is also common for women diagnosed with ADHD to continue to suffer from comorbid conditions. Some of them are sleep problems, such as the circadian rhythm disorder, narcolepsy, and other sleep disorders. Sometimes they may be suffering with anxiety, mood disorders, autistic spectrum disorder, also known as ASD. Binge eating seems to be closely related with ADHD as well. Types of ADHD in women. Inattentive ADHD is by far the most common type of ADHD, and the least frequent type is the hyperactive presentation. For more information about different types of ADHD, you can watch my videos where I explain types of ADHD. Conclusion: ADHD in women is an interesting topic, and although the condition was not well recognized in the past, we are seeing more women seeking help, and we need to understand that women suffering from ADHD can be equally, if not more, affected by this condition. However, the symptoms can have a different presentation. With more recent awareness of ADHD in women, the future diagnosis rate may be very likely to change. More research is necessary in understanding how the condition may be diagnosed and managed in women suffering from ADHD. If you experience symptoms of ADHD, talk to your mental health professional or healthcare provider. Having the appropriate support can significantly improve your quality of life and well-being.